I want to talk to you today about a particular heart sensation that a fair number of older adults notice and find unsettling, and that's usually harmless but worth understanding. A fluttering, flip-flopping, or quivering feeling in the chest, as if your heart turns over, flutters, or does a little dance, and what this can mean. Because this fluttering sensation is distinctive and a bit alarming, and it's natural to wonder if something is wrong with your heart. Yet this kind of fluttering is usually due to harmless extra or early beats, and is very common, while sometimes worth checking, so understanding it helps you respond wisely. So today I want to explain what causes that fluttering or flip-flop feeling, why it's usually harmless, the common triggers, when this kind of palpitation is worth checking, and what to do in partnership with your doctor. And I'll keep this calm and balanced, because while a fluttering feeling in the chest is usually harmless, palpitations can sometimes warrant checking, and understanding the difference lets you respond wisely, neither over-worrying nor missing the signs that matter, in partnership with your doctor. This is about an unsettling but usually harmless sensation, held in proportion. Let me start with what causes that fluttering or flip-flop feeling, because understanding it is reassuring. That fluttering, flip-flopping, or quivering feeling in the chest, as if your heart turns over or skips and then thumps, is usually due to what doctors call extra or early beats, ectopic beats, which I've discussed, and which most people experience and are usually completely harmless. When your heart has an early extra beat, followed by a slightly longer pause and then a stronger beat, you can feel it as a flutter, a flip-flop, or a sensation of the heart turning over or skipping. Sometimes a short run of these extra beats, or the heart's normal variations, can feel like a brief flutter or quiver. These sensations are extremely common, and the vast majority are benign, occurring in healthy hearts. So that fluttering or flip-flop feeling is usually these harmless extra or early beats, which nearly everyone has, felt as a flutter or turnover, not a sign of a serious problem. So understanding that the fluttering is usually harmless extra beats is reassuring. So the flutter is usually benign extra beats. So that flip-flop feeling is usually harmless. Let me reassure you about how common and benign this usually is, because it matters. Let me reassure you, occasionally feeling a flutter, flip-flop, or quiver in your chest is extremely common and usually completely harmless, experienced by many healthy people, including older adults. The occasional extra beat felt as a flutter, even if unsettling, is a normal quirk of the heart's electrical system and usually means nothing is wrong. As I've discussed about palpitations generally, common things can make these extra beats and flutters more frequent or noticeable, including caffeine, alcohol, stress and anxiety, tiredness, and others, all usually benign, and you may notice them more when resting quietly, as at night. So please don't be alarmed by the occasional fluttering feeling. The large majority of such experiences are harmless. The nuance I'll discuss is about certain patterns or accompanying features warranting checking, not the occasional benign flutter being a worry. So, occasionally feeling a flutter or flip-flop is extremely common and usually harmless, a normal quirk often made more noticeable by caffeine, alcohol, stress, or tiredness. So the occasional flutter is usually benign. So don't be alarmed by occasional flutters. Let me give you the common triggers, because reducing them can help. Several common benign things can bring on or increase that fluttering feeling, and reducing them can help if it troubles you. Caffeine in coffee, tea, energy drinks, and some other products is a common trigger. Alcohol can trigger it. Stress, anxiety, and strong emotion commonly bring on flutters. Tiredness and lack of sleep can increase them. Certain foods or eating a large meal can in some people. And stimulants, including some in cold and other remedies, can. So, if you get frequent benign flutters, reducing caffeine and alcohol, managing stress, and getting enough rest can lessen them. So common triggers for the fluttering feeling include caffeine, alcohol, stress, tiredness, and stimulants. So reducing these can help if benign flutters trouble you. So reducing triggers can lessen benign flutters. So common triggers are worth reducing. Let me be clear about when this kind of palpitation is worth checking, because some warrant attention. While usually harmless, the fluttering feeling, like other palpitations, is worth checking in certain situations, as I've discussed. See your doctor if your palpitations or flutters are frequent, persistent, or worsening, are prolonged, or come as a sustained run of fluttering or a sustained fast or irregular heartbeat, rather than the occasional brief flutter. Come with chest pain, breathlessness, dizziness, or fainting, which is more concerning. Feel like a sustained irregular or quivering heartbeat, which could relate to a rhythm problem like the atrial fibrillation I've discussed, where the heart's upper chambers quiver, or occur in someone with known heart disease or significant risk factors. And crucially, seek prompt or emergency attention for palpitations with chest pain or pressure, severe breathlessness, or fainting. By contrast, occasional brief flutters, without these features, in an otherwise well person, are usually benign, though worth mentioning to your doctor if frequent or concerning. So see your doctor for flutters that are frequent, persistent, prolonged, sustained, and irregular, or come with chest pain, breathlessness, dizziness, or fainting, or in those with heart disease, while occasional brief flutters without these are usually benign, and seek emergency care for palpitations with chest pain, severe breathlessness, or fainting. So know when flutters warrant checking or urgent care. So heed the concerning features. Let me note the atrial fibrillation connection, because it's worth understanding. It's worth understanding that the fluttering or quivering sensation can, in some cases, relate to a heart rhythm problem, and that the quivering of atrial fibrillation, where the heart's upper chambers quiver rather than beat properly, can sometimes be felt as a fluttering, quivering, or irregular sensation, often sustained and irregular rather than the brief single flutter of a benign extra beat. As I've discussed, atrial fibrillation is important to catch because it raises stroke risk and is very treatable. So while the occasional brief flutter is usually a benign extra beat, a sustained, irregular, or persistent fluttering or quivering, especially with other symptoms, is worth checking, since it could be atrial fibrillation or another rhythm problem worth catching. So a sustained, irregular fluttering or quivering, unlike a brief single flutter, can sometimes be atrial fibrillation or another rhythm problem worth catching, since atrial fibrillation raises stroke risk and is treatable. So sustained irregular fluttering can be a rhythm problem worth catching. So heed sustained irregular fluttering particularly. Let me give you what to do because the response is clear. For benign occasional flutters, reassurance and sensible measures help. Understand that the occasional fluttering or flip-flop feeling is usually harmless extra beats. Reduce triggers like caffeine, alcohol, stress, and tiredness. And don't be alarmed by the occasional flutter. But see your doctor if your flutters or palpitations have the concerning features: frequent, persistent, prolonged, sustained, and irregular or quivering, or with chest pain, breathlessness, dizziness, or fainting, or in those with heart disease, so the cause can be assessed, often with heart rhythm monitoring and other tests, and any rhythm problem like atrial fibrillation or underlying cause found and treated, and seek emergency care for palpitations with chest pain, severe breathlessness, or fainting. So manage benign occasional flutters with reassurance and reducing triggers, but see your doctor for concerning flutters, and seek emergency care for the serious ones. So reassure and manage benign flutters, and check the concerning kind. So the response depends on the features. Let me paint you a quick picture of how this helps, 2 ways. First, picture a woman in her 70s who's been unsettled by a fluttering, flip-flop feeling in her chest, as if her heart turns over, especially when she's had a lot of coffee or is stressed. She learns that this is usually harmless extra beats, very common, and that her caffeine and stress are likely triggers. So, reassured, she cuts her coffee, manages her stress, and stops worrying about the occasional flutter, which troubles her far less. That's the common, reassuring case. Now picture a man in his 70s whose fluttering is sustained, irregular, and persistent, sometimes with breathlessness, not just an occasional brief flutter. Rather than dismiss it, he sees his doctor, who, with heart rhythm monitoring, finds atrial fibrillation, which is then treated, including protecting him from its stroke risk. The contrast shows the value of understanding which flutters are benign and which warrant checking. So understanding the fluttering feeling reassured one and caught the other's atrial fibrillation. Let me speak briefly to those of you caring for an older parent or partner. Understand that a fluttering or flip-flop feeling in the chest is usually harmless extra beats, very common and often triggered by caffeine, alcohol, stress, or tiredness, but that some flutters warrant checking. You can help by reassuring them about occasional benign flutters and suggesting reducing triggers like caffeine and stress. But encourage seeing the doctor if the fluttering is frequent, persistent, prolonged, sustained and irregular or quivering, or comes with chest pain, breathlessness, dizziness, or fainting, or occurs with heart disease, since these can reflect a treatable rhythm problem like atrial fibrillation. And know that palpitations with chest pain, severe breathlessness, or fainting need emergency care. Helping a loved one tell benign flutters from the concerning kind, and check the latter, can reassure them while catching anything important. So let me draw this all together. A fluttering, flip-flopping, or quivering feeling in the chest, as if your heart turns over, is usually harmless. It's typically due to extra or early beats, which most people have and are usually completely benign, felt as a flutter or turnover, and often triggered or increased by caffeine, alcohol, stress, or tiredness. So the occasional flutter is usually nothing to worry about. But flutters are worth checking if frequent, persistent, prolonged, sustained and irregular or quivering, or accompanied by chest pain, breathlessness, dizziness, or fainting, or in those with heart disease, since a sustained, irregular fluttering can sometimes be atrial fibrillation or another rhythm problem worth catching, while palpitations with chest pain, severe breathlessness, or fainting need emergency care. So manage benign occasional flutters with reassurance and reducing triggers, but see your doctor for the concerning kind, and seek emergency care for the serious ones. So here's what I'll leave you with, straight and clear. First, understand that a fluttering or flip-flop feeling in the chest is usually due to harmless extra or early beats, which most people have, felt as a flutter or the heart turning over. Second, know that this is extremely common and usually completely harmless. A normal quirk often triggered or increased by caffeine, alcohol, stress, or tiredness, so the occasional flutter usually means nothing is wrong. Third, reduce triggers like caffeine, alcohol, stress, and tiredness if you get frequent benign flutters, and don't be alarmed by the occasional one. Fourth, see your doctor if your flutters are frequent, persistent, prolonged, or feel like a sustained, irregular, or quivering heartbeat, or come with chest pain, breathlessness, dizziness, or fainting, or occur in someone with heart disease, since a sustained, irregular fluttering can sometimes be atrial fibrillation or another rhythm problem worth catching, given atrial fibrillation raises stroke risk and is treatable. And fifth, seek emergency care for palpitations with chest pain, severe breathlessness, or fainting. A fluttering feeling in the chest is usually a harmless quirk, but some flutters warrant checking, so understanding the difference lets you respond wisely, reassured about the benign and checking the concerning, which is well worth doing. So take care of yourself, understand benign flutters, reduce triggers, and see your doctor for the concerning kind. And because a sustained irregular fluttering can sometimes reflect a treatable rhythm problem like atrial fibrillation needing diagnosis, please treat frequent, persistent, prolonged or sustained irregular flutters, or flutters with chest pain, breathlessness, dizziness, or fainting, as your reason to see your own physician and seek emergency care for palpitations with chest pain, severe breathlessness, or fainting.